I'm not going to go into a long, lengthy discussion about the causes of cancer, but I will bring them up and how they may apply to you or not apply to you. We are living in a sea of chemicals, whether we like it or not. And I tell people we cannot change the world today or tomorrow, but you can change your little environment yourself, your bubble that you live in. You can control that. So what causes cancer? Toxins, toxins, toxins. But what kind of toxins are? Because patients go, oh, you think I'm really toxic, Dr. Connealy? And I go, yes, yes, I know you may not see them, but they are there. In fact, your mother downloaded, when she had you, a flood of toxicity. So what kind of toxins are there? Well, there's insecticides and pesticides. They're all carcinogenic. Industrial toxins, they use over 100,000 chemicals, and it's growing by the day. And what percent of the test, what percent of these toxins do they actually test for toxicity? Probably about 11%. So they don't know if they even have the potential danger because they don't even look at it to see if they are. Heavy metals, not the heavy metal band, but heavy metals like in mercury, lead, cadmium, arsenic, aluminum, and uranium. If I checked everyone here, I guarantee you that every single person would have something, and most of us would have more than something. The average woman, just using lipstick, has 6 pounds of lead. Xenoestrogens, that's a wonderful chemical word. Xeno is the Greek word for foreign. Estrogens, we know what estrogens, not the estrogen that every single person makes here, because even guys make estrogen, even though they don't know that they do, but they make estrogen. But God would not have created the body for you to self-destruct with your own hormones. But xeno are the estrogens that they're out there in the environment. There are the biggest pollutant in man today is plastics. You have to eliminate plastics. Remember I talked about the peroxisomes? The peroxisomes are basically attacked and plasticized with the plastics, and so it basically deactivates their ability. Oh, I lost my slide. Anyway, so plastics you have to eliminate. And they're not only plastics in your water drinking bottles and your storage containers and the plastic wrap of your cheese and the plastic wrap of your bread and the plastic wrap of every single thing that you buy and the food that you buy, but it's also in your car. It's in the machinery here. Lots of things exude plasticity in your body, and you absorb it because the largest organ in your body is your skin. So you have to. Now, probably the most difficult thing about plastics is it's very difficult to detoxify from plastics. Polluted water. Please do not drink polluted water. And I'm not talking about the local pond or the local lake or your ocean. I'm talking about the drinking water out of your faucet. All water is polluted. This is published in journal after journal. What kind of pollutants do you think you have in your water? Well, you have heavy metals, you have chlorine, you have fluorine, you have industrial toxins, all the toxins, including medications, chemotherapies in the water, birth control pills in the water, OxyContin's in the water, Prozac's in the water. All of those things in your water, so you're getting it from all these sources that you're not aware of. Water, tobacco and smoking, that's an obvious thing. There's over 400 toxins in tobacco. Immunosuppressant drugs. Immunosuppressive, well, why is that bad? Because it suppresses your immune system, making you a perfect victim for cancer. All drugs, I talked to you about the number 3 cause of death. Some people say it's the number 1. I'm not going to get into that. But the number 3 cause of death is the properly prescribed use of medication. not improperly, properly prescribed use of medicine. All medicines are toxins. All medicines interfere with the magnificent biochemistry of your body, and there is a complication with each one of them. Just go look it up yourself in the physician desk reference. Irradiated food. Our food is irradiated to get rid of the bugs, but it also changes the DNA of that particular food. Additives. There's hundreds and hundreds of additives in the food, from dyes to preservatives to everything. Mercury toxicity. Mercury is the second most toxic substance in the world. Why do you think you have mercury? Well, one is you have dental fillings. Long time ago, and even still today, doctors are utilizing mercury, and it's not only mercury in the fillings, there is nickel and tin and other metals. So mercury cannot be in your body. In fact, if we were to spill mercury right here, we'd have to call a hazardous waste unit to come and pick it up. There are about 50 professions that utilize mercury. I was listening to BBC World a couple of months ago, and there was a doctor doing a documentary on the children in South Africa, because in the mining of diamonds, they are utilizing mercury. And how old do you think the children are that are doing this? 8, 9, 10 years old. So he was describing to the reporter, he says, look at that little child. Do you see the way that their eyes are flickering? Do you see the little tremor that they have? What does China do? China burns coal. The #1 byproduct from coal is mercury. So all of China's air comes here. Dental factors. Okay, the last time I looked, your mouth is connected to your body. And so your mouth is the gateway to everything. So in fact, every one of your teeth correspond to an organ in your body. We all have fillings. We all have infections. But dental infections suppress the immune system by 70%. You have to have a mouth that is clean, it is rid of infections, and it is doing the job that you need it to do. Sunlight. Sunlight is wonderful for us, but it also, too much of a good thing, can be damaging, especially now because of the depletion of the ozone layer. Electromagnetic fields, the invisible energy web of smog, of electricity. Unfortunately, Edison did us a great favor by inventing the light bulb. But also, if you think about when Edison invented the light bulb, and you think about the increased risk of diseases, because cancer was 1 in 100 over 100 years ago, and if you look at disease now, is it increasing or decreasing? Increasing at small rates or large alarming rates? Alarming rates. And you know, children, a long time ago, when I was growing up, there wasn't anybody sick, really. No one was on ADD medicine, and nobody was obese, and nobody came to school with their hair loss because of chemotherapy. So something is obviously wrong. Now, I know we're not the only ones here seeing this. I mean, I know that. But I don't know why people are looking the other way. We all need to do a timeout, say, wait, stop, listen, what is going on here? So I know you're not going to get rid of your cell phone today. I know you're not going to get rid of your iPad and your computer, but you're going to have to take measures that I will not talk about right now because the other speakers will do that today. But the most important thing that you can do is daily connect with nature. Go take a hike, go walk on the grass, go walk on sand, connect with nature in some sort of fashion. Yes, there are other devices that you can use, grounding sheets, all kinds of things. So, but it is a very serious thing. In fact, some people think that it is the greatest danger and threat facing humanity today. Now, there is something in science called the precautionary principle. What a thought. Okay, if we know a little bit of data, you know, why wouldn't we extrapolate that and err on the side of caution? Sick building syndrome. What that is they renovate a new house, a new building, and it has all kinds of toxic pollutants. So you have to be careful about that. Now, there are now green buildings and greenhouses, thank God for this transformation. Ionizing radiation, that's the radiation that we get every single day from EMFs, chest x-ray, CT scans, a PET scan, all of these things are radiation. They cause DNA damage. DNA, remember, is what directs every one of your cells. And then not to mention the nuclear radiation. Now, nuclear radiation, we know of Chernobyl. Then the most recent one is Japan. Don't think they have it all fixed in Japan yet, because they don't. If you can look in Orange County where I live, they have a website to tell you the radiation levels of the day. Bugs. Bugs. There's 4 classifications of bugs: viruses, bacteria, fungi, and parasites. So bacterial infections, you know what those are. Like if someone gets pneumonia, they drag the immune system, and what do? They create inflammation. Fungus. You're going to have a great speaker, Doug Kaufman, who I've known for years. He has written book after book on fungus. Fungus, you'd be surprised, causes every disease from head to toe, from clouded thinking to cancer to heart disease to immune suppression, on and on and on. So funguses are rather easy to get. If you take antibiotics one day, you can have a yeast infection. You know how women, they are given an antibiotic and then they go, I have a yeast infection. Well, it's just not in one area of the body. Your body is a holistic system. If you take birth control pills, you're higher risk for candida. If you eat sugar all the time, you're higher risk for candida. If you're toxic, you're higher risk for candida. Parasites. Well, we live in the United States. We are so clean. We're so perfect. We couldn't possibly have parasites like China and India. Well, believe it or not, it's one of the leading causes of death in the world. Parasites are real. Sometimes you have symptoms, sometimes you don't. In fact, Discover magazine had the mysterious illness of the month, and the patients were in a coma from parasites. There is no adequate stool testing, because if you really want to know if someone has parasites, you need to examine their stool within 20 minutes of them having a bowel movement. Well, that's kind of hard to do. So you have to have other ways of looking for parasites. There's over 500 species of parasites, and so it's a big problem. I'm not going to go into detail, but it is a big problem, and you have to get rid of the parasites because, again, they're a nidus of inflammation.